This is your first question on your screen. My name is Harshil. Welcome to Decode Healthcare with Harshil. Uh, we'll be starting with ICD, shall we? Combination codes are single code used to classify two diagnoses or a diagnosis with an associated secondary process or associated XYZ. We'll have to fill in the blanks among the four options. If you've got the answer, why not skip ahead with 10 or 15 seconds? If you have not got the answer, try to get the answer via the book. Open your book with ICD, get your answer quickly. All right. This was easy one as there is no uh, you know you don't have to lead any code. The answer to this question is complication. So combination codes are a single code to classify two diagnoses or a diagnosis with an associated secondary process or associated complications. All right, there you go. The second question, in an ICD 10 cm, a placeholder character is used for codes requiring the seven character extender. The placeholder is represented as you will have four options here. Why don't you check? You might get the answer in the guidelines as well. All right, again, an easy one. This is absolutely a sitter. The option is C and X. Moving on to question number three. There you go. You'll have to lead a code in your book. Patient with viral hepatitis C and continued alcohol use is diagnosed with malignant primary neoplasm of the liver. You have your four options. Try to get the answer as quickly as you can. All right, the answer to this question is option obviously C. You'll have three conditions here. That's viral hepatitis C, alcohol use, and the one that is being diagnosed right now is malignant primary neoplasm of the liver. So you'll have the sequence as what is mentioned here. Since he's diagnosed with cancer here, so the code cancer will be sequenced first. Moving on to the next question. Patient arrived in the ED complaining of having severe right upper quadrant pain, nausea, and vomiting for several weeks with 20 pounds weight loss. That's revealed a mass within the gallbladder. However, no cholecystitis or stones. The patient was admitted and a surgeon was consulted. The next day, a cholecystectomy was performed. Pathology results show the patient to have cancer of the gallbladder. Code the diagnosis for the surgery. There you go. The correct answer to this question 4 is C 23. Sorry, B, option B. C, 23. Cancer of gallbladder. There you go. Moving on to next question. Question number 5. Dr. C sees a patient with nasal hemorrhage, confirms a fibro-optic exam of the nasopharynx. A mass is encountered at the nasal concha and a biopsy is taken. Pathology report shows cancer. Additional surgery is planned. The correct answer to this question 5 is option C. It is C30.0. It's cancer of what? You have a location mentioned here. It's nasopharynx. You have nasal mentioned here. You have also mentioned as nasal bronchi. All right. Moving on to question number 6. Patient with thyroid cancer has fever and found to have chemo drug induced agranulocytosis. There you go. A bit difficult question for you guys. Uh, the correct answer to this question is option D, that is D701, T451X5A, C73, and the last one for fever, R5081, as a fever is an adverse effect of the chemo drug that also has caused agranulocytosis. Going on to next question, question number 7. Baby born with thrombocytopenia purpura also is found to have absent radius. The correct answer to this question, a baby born with thrombocytopenia purpura also is found to have absent radius, is option C, Q87.2 and D6942. That's its you know given a priority on sequencing. Moving on to next question. A patient has post-operative hemorrhage due to accidental puncture of the spleen during gastric bypass surgery. Uh, this is a bit, you know, uh, a bit of confusion in this question. What I feel the right answer is option D7812. Yeah, option C. That's what I feel is the right answer here. As it's intra-operative or right after the operation, post-operative complication that has arisen here. That is why I'll be going with D7812, option C. Moving on to next question, option 9. Question 9. A patient diagnosed with beta thalassemia minor should be coded. This shouldn't take you more than 15 seconds. There you go. The right answer to this question is obviously D563. That is option B here. Moving on to last question. Patient with type 1 diabetes with a diabetic retinopathy is seen for an eye checkup. After a thorough examination, the ophthalmologist determines the patient has a retinal edema. Right. While you answer this question, please make sure you like and subscribe to the channel as well, and let me know in the comments what are you looking forward to for practicing on, if at all you're preparing for any certification on medical coding, or someone who is just a medical coding profession and is just here to practice. All right, let me know in the comments as well. There you go. If you have got the answer, why not skip to 20-30 seconds ahead, and yeah, you'll find the answer as well in the video. And yeah, I should thank you for watching this one. And please share it with your peers and colleagues and someone who is preparing for this certification, or someone who's just studying medical coding in general. All right. My name is Harshil. Thanks for watching. This is Decode for Health. Decode Healthcare with Harshil. And the right answer to this question is option D, E10-311, as it's type 1 diabetes with a complication as diabetic retinopathy. All right, there you go. I'll see you in the next one. My name is Hasil, and yeah.